We're at Health Day.
Yep.
It's amazing to be here. It's been a year of work for many, many people. What do you think? Can you believe it?
Well, I can't believe it, Jenny. 27 COPs later, the real face of climate crisis is woken up choking, coughing, feverish. I can't believe how self-destructive humanity is, actually. But we must thank the UAE COP28 presidency that saw the light, planned this day, created a multi-stakeholder steering committee to make this day a success. But I also want to recognize the leadership of the World Health Organization that is represented here by DG Tedros because of the long-term leadership in getting where we are. But all those ministers of health who've raised their voice and put their energy to where we are today to ensure that health is truly brought forward as the real face of the climate change. And special mention to my sister, the Minister of Health from Malawi, who has actually given a lot of leadership on this. But let's thank ourselves to Jeni on behalf of all the people who surround us, the people who've been working with us on this journey, including scientists that we represent here, health workers who are represented here, young people like Dr. Omni and others. I think it's been fantastic to get here. But you've been part of this journey for a long time, Jeni. What does the journey feel like to hear?
You know, just last night I was talking with someone, a colleague that I've known for a long time, who started working on climate change and health 30 years ago. For many, many years, it was a very small community. The thing that's extraordinary is that at this COP, there are literally hundreds of people from the health community at this COP. That's unprecedented. So it's been a long time coming, a long time growing, the movement of the health community that is interested in climate change and working on climate change. And I think for many years, particularly at the COPs, we felt like we were knocking on the doors, sometimes quite literally, like running around and knocking on the doors of different country delegations and bringing the health message and saying, this is important, the climate crisis is a health crisis. This year, it's actually quite amazing to have an official platform for this message for the first time ever. But you've been leading this work across Africa. What has it been like for you to build this work in Africa?
I've seen real convergence of action, actually, passion and social justice rising. I've seen realization by ministers of health, and many of them expressing themselves and saying that actually every climate crisis converges in the health ministry. Every single one of them. When there's flooding, those individuals need care. When there's pneumonia, asthma, those individuals need care. When there are rising cases of cholera, they end up in the Ministry of Health. And therefore, remember also that, unfortunately, some of them die, and the morgues are also part of the health system. So everything we are talking about converges there. But I've seen health ministers rise, and many of them are here, and start to coalesce around a common position. From Kigali, where we had the Africa Health Agenda International Conference, to the World Health Assembly in Geneva, to the Common Africa position that was hosted by the Minister of Health in Malawi, where ministers of health have converged around this agenda, to the Africa Climate Summit in Nairobi, where we hosted this. And every stop of the way, Jenny, the COP28 presidency has been present in all those meetings that I've mentioned. So this is really the moment, and the ministers of health are saying that the conference of parties, the parties in the conference, are not necessarily ministers of environment. They are the governments, where the ministers of health are actually equal stakeholders. This is what I'm hearing. So, Jenny, the first step is always the hardest. Where do we move on from here?
Yeah, so obviously, Health Day, as lovely and extraordinary as it is, can't be the end. It's got to be the beginning. And I think at this COP, it's vitally important that we carry the focus on health all the way into and through the negotiations. I was really struck on the previous panel, I believe it was Jane who said that what we're negotiating is people's lives. And so in the negotiating rooms where governments are making the decisions, we need to ensure that health is a focus there too. You know, a number of the earlier panelists and speakers have talked about the importance of phasing out fossil fuels and transitioning and really ramping up equitable access to clean energy. That can start with decisions that are taken in the negotiations this COP, and that's a really, I would see that as a really important point to make progress on. How about you? What do you think is where do you think we need to go from here this COP?
I think we need to realize that we have to bring an end to this self-suicide of fossil fuels to begin with. At the same time, we know that what was a threat, a risk of rising temperatures, global warming, extreme weather events, is now a reality today. So we must also adapt communities and make health systems resilient, because cholera is rising, malaria is rising. We can't watch that as people die. So we must also strengthen communities through all the things: health systems, food, water, education, and stable homes. And today, we are seeing that there is going to be a lot of engagement with health ministers all alongside this week, and therefore we look forward to a day where this convening is at every COP, but beyond that, the integration of health in the entire climate agenda.
Thank you. Thank you both. And with that, we will close out the session, but that was absolutely inspiring. I mean, honestly.